breast lift is done in somebody who has got a good size breast or is happy with the size of the breast. Whatever size, cup size, whatever size is there, they are happy with the breast, but the only problem is the position of the breast where it is sagging down. Such a person will benefit with the mastopexy, that is the raising of the breast. In comparison, somebody with a small breast, that is a breast which is deflated, then a augmentation is what is the right procedure to do. Hello, my name is Dr. Srikanth V. Is mastopexy what you need? Mastopexy basically is a breast lift. Now, in our younger days, the breast tends to be in a nice high position and it is in the normal position. With time, with age, or in some people who have massive weight loss, the breast tends to sag down. It sags down such that the nipple and the areola lie below the midarm level. Some people it can go down up to the elbow level or even more below. And the nipple and areola, which is supposed to point upwards and outwards, start pointing downwards. If you have any of these, then probably you are the right candidate for a mastopexy, that is a breast lift, wherein the breast tissues are tightened surgically so that the breast comes and lies on the chest wall in the more normal anatomical position. This is a common question which a lot of people do ask me. What is the difference between a breast lift and a breast augmentation? Now, a breast lift is done in somebody who has got a good size breast or is happy with the size of the breast. Whatever size, cup size, whatever size is there, they are happy with the breast, but the only problem is the position of the breast where it is sagging down. Such a person will benefit with the mastopexy, that is the raising of the breast. In comparison, somebody with a small breast, that is a breast which is deflated, then a augmentation is what is the right procedure to do. That means you fill up the volume of the breast by using most commonly a silicone implant, or if a mild to moderate fill is required, using lipofill or a fat fill. So in one, it is the position which is the difference, but the size is good. In the other, the size is small and the size has to be increased by adding some more volume to the breast so that the size comes to a pleasing or the expected size. Yes. Now, other thing that people are generally concerned is, can a breast lift and a breast implant be done at the same time? The answer is most definitively yes. In fact, that is what your plastic surgeon should be counseling you about. That is, yes, you have a deflated breast, you have a small breast, or you have a breast which is deflated and which is sagging down. And in such patients, just a breast lift alone will not give rise to a pleasing breast, or an implant alone will not lift a sagging breast. Now, this is a decision which is made by several different parameters. When your plastic surgeon examines you, he examines the size, the position of the breast, the volume of the existing breast tissue, the skin. He will tell you whether you need only a breast lift or only an augmentation, or you need a combination of both. The ideal person in whom a breast lift and implant is to be done is someone with a small sagging breast where the nipple areola lies below at the level of the midarm, probably approaching the elbow. Does a lift reduce the volume of the breast? The answer is no. What we do in a breast lift is to rearrange the breast tissues and lift them up to a normal position where they are supposed to be there. So, therefore, there is no loss of breast tissue, there is no loss of skin, and therefore, the cup size will not change. The breast, what it was before surgery, will be the same volume after surgery, except that it is going to be in a different position. If you want a change in the size, then either you have to combine it with the reduction, or if you want enlarged size, you have to combine it with the breast implant. But a breast lift, a mastopexy alone, will not change the cup size of the breast. This is one of the questions that they ask: how long does the breast lift last? Now, all the breast lifts are all done with calculations in mind, when the age of the patient, the size of the breast, the extent of the lift, the quality of the skin tone, all of this, and with certain measurements to the bony points and to the size and frame of the patient. Now, how long does this surgical effect last? The rough rule of guide is that plus or minus 10% of your body weight. Supposing you are around 60 kilos, then you can lose weight up to 54 kilos or gain weight up to 66 kilos without any noticeable size in the breast. However, if you do lose weight or if you do put on weight, then it may show on your newly formed breast. So it is good for you to think about this, discuss this with your plastic surgeon that yes, aiming to lose weight or I may gain some weight, and then discuss the size of the breast, because yes, if you vary more than 10% of your current body weight, there is a chance that there will be a change in the breast size. What are the signs that you may need a breast lift? The first obvious most important thing is that if you are personally dissatisfied the way your breast looks. Now, how do you do that? Your plastic surgeon will take certain parameters. It's probably easy for you to do it. When you look at yourself without clothes, stand in straight, shoulders straight, face straight, and examine the position of your breast. Now, healthy, youthful looking breast will lie at the chest wall with the nipple areola at the mid-arm level pointing upwards and outwards. There is a gentle slope going from the shoulder bone up to the nipple, and there is a good convexity, pleasing convexity going down up to the chest wall. Now, if your breast looks like this, then you don't need a lift. However, if the breast starts to sag, then the nipple area complex may go down. It may be 1 centimeter, 2 centimeters, 4 centimeters below the mid-arm level. It may even touch the elbow, in some people even more. So when you see that signs like that, sometimes you may find that the nipple area complex would have started to look down. If your breast looks like that and looks deflated, then probably you are a right candidate to consider mastopexy or a breast lift. Now, it is natural for anybody to be little concerned or wary about surgery. So a lot of them explore the options of a non-surgical lift to see whether they can avoid surgery, at the same time get good results with breast lift. Unfortunately, as things stand today, they are not good options, or they're only temporary options. A thread lift probably will lift the breast for about 6 months or so. So if you are the sorts who doesn't want to undergo surgery but have some event or some function that you're targeting and you want a quick fix, then probably a thread lift may be an option. However, you must remember that till date, science and research has not given us anything that can help the skin beat gravity, and at some point of time gravity will take over and these threads will fail to give you the lift that you want. So my suggestion is, if you are really considering to have perky, youthful breasts, probably surgery would be the way to go.